Senator Robinson, I want to start with you. Your bill establishes gross misdemeanor penalties for drug possession, but also encourages pretrial diversion with substance abuse treatment. So there are stronger penalties in place, or would be, than the current law, but not the felony level penalties that were in place in the law that was struck down in 2021. Your bill also gives more discretion, it seems, to police and the courts in its implementation than some of the other bills. Why do you think this is the best approach?
Well, first of all, thank you for having me to discuss this really important topic. I believe that my bill strikes the right balance between providing opportunities all along the way for people to not even engage with, there's opportunities for police to divert people before they're even booked. So opportunities to, offshoots, if you will, from the criminal legal system to get treatment, services, the help that they need. At the same time, I've heard loud and clear from my community and the people that I represent that people feel like they do need to have accountability or consequences, if you will, when someone does not choose those opportunities for treatment and assistance in that way. So I think, I just really believe that it's got the right balance between opportunities for assistance, for compassion, looking at that person as an individual, as someone with an illness, and creating opportunities for them to get well, and then also opportunities for our law enforcement and legal system to engage if necessary.
And Representative Griffey, you were on the Substance Abuse Recovery Services Committee, also known as the Blake Committee, which made a number of recommendations that are now codified in Senate Bill 5624, I believe, including legalization of personal amounts of drugs and establishing some misdemeanor penalties for possession of larger amounts of drugs, among other recommendations. What's your perspective on the issue and the recommendations that came out of that committee?
Well, thank you so much for having us here and talking about this important topic, and thank you to the good senator for running our bill. The SERSAC committee, which it took me a while to remember that's how to say it, was a great first effort, right? But it has to be our first effort. I had a minority opinion that I authored with Senator Braun, who was also on there. One thing we identified is there's not enough services. Even in the Good Senator's bill, when we talk about deferral services and other treatment services, we don't have enough by a lot. We're making, more people are falling into addiction and diseases of addiction than we're treating and we're fixing. And so this conversation and more like it has to be had all throughout every session. It is a critical time. I like to say, as a professional firefighter, there is not a single person I didn't want to save. And at this point in time, I think society is kind of getting used to stepping over people that are hurting most in our society, that we see, unfortunately, laying in our doorways, laying in our dishes, and we're getting frustrated, right? We want to do something about it, and I want to change the narrative and say, here's a number you can call and you're going to get help.
There are advocates of legalization or decriminalization who say, look, this is a public health issue, it's not a criminal justice issue, and the two just should not be intertwined. What's your perspective on that perspective?
I have listened to that, and I absolutely agree that it is a public health issue. Unfortunately, as Representative Griffey just said, we don't have the services in our communities to make them available to everyone who needs them. And until we do, and until there is enough political will to move people into those services and they are available, I think it does fall back to our legal system, which maybe someday we'll be able to move beyond that, but we're just not equipped to do that right now.
And what do you think about that?
So the SERSAC committee considered that, and I was adamant that that's not the way to go. I believe it's almost like the state of Washington endorsing drug use, because at the time we were talking about legalization and setting purity standards. You can't set a purity standard for a drug like fentanyl where the first time you use it you could pass away. Cocaine, same way. I mean, the state of Washington has no business setting purity standards for drugs that have such harmful effects or potential harmful effects. I was a no. Again, the good senators, where she's going with her bill is closer to the way I would like to have gone than the full SURSAC recommendations, but yeah, that's not something I think Washington should do.
I want to follow up on that with the safe supply work group concept. That's one component of the bill that came out of the Blake Committee ruling, and basically it will establish or would establish a work group to look at whether and how, if to move forward with establishing a safe supply of drugs for folks who are at risk of overdose. Does that, first blush, what's your perspective on that idea?
Yeah, I agree with Senator Griffey. I just don't think the state should be in the business of creating a safe supply. We're not anywhere near that spot, I think, in our history, if we ever get there. I am certainly in favor of harm reduction strategies, so clean needle exchanges, creating opportunities again for people to engage in treatment, engage in services, and reduce the risk while they are actively using, because we know that those types of services can bring someone to the point where they are able to then go into full treatment and recovery. But we're just not at a place where I could support the safe supply efforts.
Anything to add on that topic?
Well, I mean, we do have safe supply, really, especially when you're talking about the hardest drug to kick the habit of, which is the narcotic drugs, heroin, that sort of thing. We have a regulated doctor-prescribed medications, several of them. I believe that what we do is, if we want to show our loving approach, we supplement, we give a different way out. And I think our pathway should be a pathway off the drug completely. It should be a pathway to sobriety. There's a lot of people that don't think everyone can be sober, and I believe that is just defeatist thinking. I think we can give resources to make everyone clean and sober and help them take their lives back. That's where I want to go. I do believe we do have a supplemental pathway. The safe supply, I just don't think we can get there. Studying things is never wrong, but I think they're going to come to the conclusion that I have.
What do you think about Senator Padden's bill, Senate Bill 5305, which would keep the penalties that are currently in place for most drugs as far as drug possession, but would add felony penalties for the synthetic drugs, for specifically, I think fentanyl is the thing that is being looked at here in terms of its devastation, its danger, and the potential, and the impact it's played in the number of overdose deaths in Washington. Do you think that those should be treated differently? I mean, I believe your bill treats controlled substances pretty much the same.
Right. Yes, it does. I just don't think a felony is the right level of punishment for simple possession of any drug. Felonies ruin people's lives. They make it impossible for people to get housing, to get jobs, to volunteer in their kids' schools. It's just it's a record that follows that person forever. And I think someone can have a small amount of drugs, and that's not we're still making it illegal. But I just can't accept that we need to make it a felony. To me, that's going back to the war on drugs and criminalizing to such an extent that people have a really hard time recovering from it.
What do you think about felony penalties?
Well, my written statement in the opposition, or not opposition, but at least minority report to SURSAC committee was keep it felonies until we build the system, right? And have ample off-ramps. So I believe they should be felonies, but we really need to understand that everything we're talking about, and fentanyl, I think should be a felony. We have confused the issue so much so that prosecutors really do not know what the amount for intent to distribute. So we're going to have to at least give the prosecutors the ability to differentiate simple possession and what is that. In a drug like fentanyl, you break that tablet into 6 different pieces and you still have more narcotics than most prescription narcotics. So I think we have to be really smart about how we go about this. There should be stronger penalties for fentanyl. Heck, they're making it into Skittles shapes and colors. Kids are getting it. 4 kids in one of my local school districts had to be rescued with Narcan almost a month ago, right? This is epidemic proportions, and we have to get serious. We have to define what possession is with intent to distribute, and a lot of these bills can confuse that. We have to have prosecutors be able to go after the supply.
So this has been an issue that we've seen interesting, I would say, pairs of lawmakers on bills with this one. And, you've got different members of the same caucus lined up on different sides or similar bills, sometimes very different bills. From your perspective as a legislator and your experience as a legislator, how's the Blake ruling and the response to it been to be part of that process? What has it been like?
It's a very challenging and thorny public policy issue where sides get blurred, as you just alluded to. As I've described it to people in my community, I have colleagues who I know will not vote for anything but a felony. I also have colleagues who I know will not vote for anything but decriminalization. I don't think either of those are the right path, and I think generally the public doesn't think either of those are the right path. I may be wrong, but that's my impression, at least the people I represent. So our job together is to find a path through the middle of that. And that will probably require some interesting partnerships along the way. And
what has the process been like from your perspective, Representative?
Well, it's too slow. I really would like to see us get more help. I mean, I'm a professional firefighter. Like, there's nobody whose life I don't want to save, right? But I think the good senator's bill probably meets a closer balance to what I could get behind. So I do thank the good senator. Thank you so much. Gross misdemeanor gives you a potential sentence of 1 year in prison, the real prison. That I think if there is a deterrent effect, that might be the deterrent effect, right? I don't want to go there. Maybe I will sign up for the diversion that we're offering up that we would like to see. Anyway, thanks.
So, in terms of stakeholders, municipal stakeholders, there was a representative, a person who represented city government in Spokane who spoke in favor of your bill, talking about the cost and the way that cost could be avoided with diversion as opposed to going back after a trial. Just talking about the expense of just bringing someone up on charges, holding someone in jail, and that sort of thing. How do you see this debate impacting local governments? What have you heard from the communities in your district?
I've heard a lot. I mean, currently my local governments, and I would say particularly my local mayors and police chiefs, are very frustrated with the bill that we put into place 2 years ago and have really asked for us to correct, change direction, change course. And I think at the same time, no one really wants to prosecute every person who's on the street with a small amount of drugs. That is not a good use of resources, and I believe that local governments recognize that. So they're asking for other tools that are both effective and meaningful and offer compassionate, solutions to the folks that they're having to deal with in our communities and on the streets.
What about the representatives, or rather the municipalities in your district?
Well, so we can't just talk about this issue, right? The whole suite of bills that I think the legislature passed that really threw a monkey wrench into the works, right? Police pursuit, all of the stuff have to be added up. We've seen emboldened criminal behavior, and in that emboldened criminal behavior, we see people that are cloning actual prescribed drugs, Percocet. I told you the story about my dear chief's son that passed away when he took what he thought was a Percocet. We have got a lot of work to do. It's not just drugs. It's adopting a co-occurring mindset, meaning if mental health is substance and substance is mental, so we have more resources. The state really kind of nips around the edges of that, but we have got to officially finally do that. We're going to have to pass some reforms to the law enforcement issues that we have because out of control criminal behavior is the #1 thing that my locals are telling me we got to get on top of.
We've got just over 3 minutes left. Do you have anything to add specifically to that before we move on?
I think it's important to remember that while our local governments and local communities are really struggling with this, the criminal behavior that we're seeing is a national phenomenon, as well as drug use, fentanyl abuse, and that's not to excuse it in any way or say we shouldn't deal with it, but I do think it's important to put it in a national context. We are, the pandemic sort of upended us as a society, and we're trying to find our way through. And some of these unfortunate behaviors and effects of that are seen across the country.
So in terms of paying for treatment and getting up, just creating resources, creating beds for inpatient treatment or spots for outpatient treatment, what's got to happen?
The state needs to provide additional funding. We have done quite a bit. The beds are coming online, not enough. We need to continue to fund. We also need to really work with our local communities to make sure that facilities can get sited. I mean, it just seems like time and time again, a provider wants to come into a community and the community rises up and says, no, we don't want them here. And that has to stop as well. We have to be able to site these facilities in every community in order to provide the services.
Well, I think it's obvious we have to build a continuum of care that starts from a ground level and builds it to a position where we help someone rebuild their life. I believe in the crisis receiving facility model where our law enforcement and firefighters, EMS, can drop people off in a therapeutic receiving facility. That's a 72-hour hold facility. All too often in my community, for them to get civilly committed now for at least a protection hold, we have to wait for a DCR. The DCRs could be 2 days away. This would be a stabilizing and therapeutic setting. The legislature has worked on funding for those sort of facilities. We need to get them up and running. But that continuum of care has to be, then what's the next level? Where are they going to go? It shouldn't be based on if you have enough money to recover, because if they had enough money, they probably would have recovered. At this point in time, we have so little resources that it really is, if you have money, you can probably get better in Washington. If not, we're going to have to try to find a spot for you, and I think that's sad.
Well, we're almost out of time, but if you could encapsulate your closing thoughts about this, anything I didn't ask, anything you want to add?
Oh gosh, well, this will be an interesting journey through the legislature. I can't even predict how it's going to end, but we put bills out. Were heard yesterday, and we'll see what comes out of the committee, and I look forward to working through the process, and both my colleagues in the Senate as well as my friends in the House, and to get the best policy that we can for our residents here in Washington.
Representative?
Well, I think we should embrace those people that are in need the most, and we should change the narrative in the society that there's ample resources and we're not going to step over the people most in need. That is my goal, and I will work until I'm not in the legislature again to establish such a life.
We'll have to leave it there. Thank you both for your perspective. Please